everyone, welcome back to another week of the U of S Physio project. As always, my name is Chris. If you've been following us from the very beginning, you'll notice that this week's video has a bit of a different flair to it. This week, as opposed to other weeks where we've been demonstrating exercises and talking about ways to correct things like posture and treat lower back pain, this week we're going to be talking about cardiovascular exercise and how it can benefit our everyday lives. Because a lot of the people that are watching these videos spend a lot of their time sitting at desks, we anticipate that there's not a lot of people that have a great opportunity to do a lot of cardiovascular exercise or test their cardiovascular fitness. So if that sounds like you, stay tuned to this video and we'll hopefully be able to help you out. So for those who might be unfamiliar with the concept of the cardiovascular or cardiorespiratory system, I'm going to very briefly describe what it is. Essentially what it is it's our heart and our lungs and all the blood vessels throughout our body. When our heart beats, it's pumping blood through our body, and there's oxygen within our blood that goes to things like our muscles and our brain, and that's what allows us to do activities within our daily lives. If we have a poor cardiorespiratory system, we get tired a lot quicker, and it doesn't allow us to do a lot of things that we want to do, such as going up and down stairs or exercising or playing with our pets or with our kids. So it's important to train this system, because if we don't train it, essentially we can't do a lot of things that we want to do. So this is what this video is going to be discussing.
Now that Chris has explained what the cardiovascular system is, I'm just going to list a couple of benefits in training this system. So when training your cardiovascular system, you're going to decrease your heart rate for a given task. You're going to regulate your blood pressure, so that means at rest your blood pressure is going to be lower. And you're also going to increase your body's ability to utilize oxygen. So that's going to make, say, climbing stairs easier, like Chris said, playing with your kids, taking your dog for a walk. All that stuff will become easier if you train your cardiovascular system.
So now that we understand a little bit more about what the cardiorespiratory and cardiovascular systems are and what they do, we can now understand or try to train them. So before we get on that, it's important to understand our heart rate and our maximum heart rate with respect to training. The maximum heart rate that anyone ever wants to reach is 200 beats per minute minus their age. So if you're a younger person, your heart will generally beat faster, and therefore when you're training, it can beat faster. And as you increase in age, you generally don't want your heart rate to increase as much. So if we take the equation 200 minus our age, that's our maximum heart rate. And when we're training our aerobic system or our endurance system, things that we train when we're, say, going upstairs or running on a treadmill, we generally don't want our heart rate to surpass 70% of our maximum heart rate. So if we calculate maximum heart rate and multiply that by 0.7, generally that's the heart rate that we want to achieve. Now if you're running on a treadmill, for example, and there's a heart rate monitor, or you wear a heart rate monitor, you can keep track of your heart rate when you're running on a treadmill or doing a stair stepper or lifting weights, for example, and you can keep track of your heart rate that way. And if you keep your heart rate within that set parameter, or that small gap between changes in heart rate, you'll be training your aerobic system. And that's what we want, because that's going to allow us to do a lot of the things that we do within our daily lives.
Here I'm just going to take you through that equation that Chris was talking about to determine your max heart rate. Keep in mind though, this is just an estimate and it's not 100% accurate. However, it will give us a good estimate to base our exercise heart rate off of. So as he was saying, it's 220 beats per minute minus your age to get your max heart rate. So here I did this equation for myself and incorporated my age into it. So I'm 23, so I simply just put 23 into the equation. So we would take 220 minus 23 to get 197 beats per minute. So my max heart rate would be 197 beats per minute. So now that we have that, we can figure out our exercise heart rate by multiplying it by the intensity which we would like to work out at. So if we want to exercise at a moderate to vigorous intensity, so right in the middle, we would want to be working at 70% of our max heart rate. So in order to figure it out, we would take my max, multiply it by 70%, so that's what we've done here, 197 beats per minute, multiplied by 70% to get my exercise heart rate of 138 beats per minute. So that means if I want to work out at a moderate to vigorous intensity of 70% of my max heart rate, I want to be working out at 138 beats per minute.
So now, this is where this week's video is a lot different than past weeks. In the past, we've shown exercises or demonstrated things, specific things that we want the staff to be doing. But this is where you get a little bit of freedom and a little bit of an option for experimentation. So, as I've explained before, you now know what your maximum heart rate should be and the heart rate range that you want your heart to be beating around to be training this endurance system or our cardiovascular system. So now that we understand that a little bit more, I'd like everyone to try and go out and find something that gets their heart rate going up a little bit more, whether it's taking the stairs at work or getting up and walking around about every 30 minutes during work, whether it's walking around the block during lunch, going for a run on the treadmill. It's really up to you. Look for things that pique your interest, that get you moving, and let's try and train our cardiovascular systems, all right?
Before beginning a cardiovascular training program, it's important for you to consult with a doctor to ensure that you are ready to go ahead with this. Having high or low blood pressure can be dangerous when you're considering cardiovascular training. So therefore, it's very important for you to make sure that your body and your cardiovascular system is ready to begin exercise. So now that you know a little bit more about the cardiovascular and cardiorespiratory system, I'm just going to give you some of Canada's guidelines for exercise. So Canada recommends that individuals aged 18 to 64 undergo 150 minutes of moderate to vigorous exercise per week in bouts of 10 minutes or more. So as Chris was explaining, you can calculate your moderate to vigorous intensity using the 220 minus your age calculation. So moderate exercise is classified as 50% to 70% of your heart rate max, and vigorous exercise is classified as 70% to 85% of your heart rate max. So you can go ahead and try calculating that yourself and determine what exercise range you would like to work out in. That's going to conclude this week's video. Thanks for tuning in, and we hope to see you guys again.